Hi, I'm Andrew. I'm a medical student and my research project is on valvular heart disease. I'd just like to take a moment first though to thank my sponsors, OMRF, the Otago Medical Research Foundation, and Walsh and Beck creative agencies. The heart circulates blood throughout the body, where it receives deoxygenated blood from the body, sends it to the lungs for oxygenation, and then sends it back through the body. To ensure unidirectional flow, various valves are in place at key locations. In aortic stenosis, there are several things that will happen to the heart. For starters, there will be structural changes to the aortic valve, which you can see with different scans or with the naked eye. And in particular, there will be changes to how the blood behaves in the heart. Those changes form the backbone for diagnosis of aortic stenosis. So the structural changes are changes in the valve area, and the changes in the blood behaviour are the changes of the pressure of the blood and the velocity of the blood as it goes through the aortic valve. In aortic stenosis, the pathway for the blood to be pumped through becomes smaller, and that changes several things about the blood. Without aortic stenosis, the hole is much bigger, so you don't require as much pressure to pump the blood. But in aortic stenosis, the hole is small, so you need much more pressure to adequately pump the blood. For the final characteristic change in the behaviour of the blood, the velocity of the blood also increases in aortic stenosis. Much like a garden hose, when the hole is large, the velocity is not that high. But when you cover the hole or make the hole smaller, the velocity skyrockets. Echocardiography is used to diagnose aortic stenosis as it can measure all three factors, though MRI may not be able to measure the velocity as well as echo. My project will aim to see whether MRI can be used to measure peak aortic valve velocity by comparing measurements made by echo with those made by MRI. I will then use a variety of fun statistical analyses such as simple linear regression or Bland-Altman analyses to measure the degree of agreement between the two measurement modalities, which is a fancy way of saying seeing whether MRI is close enough to echo.